There we go. Can you hear me now?
Yep, that works good.
Yeah.
Okay. Just to catch you up, but you missed, we thanked Dennis and he got his award. We approved the minutes. And we are now prepared to move on to the executive director's summary.
Thank you. And just to recap quickly, we ended open enrollment. Great job this year. Andy's going to come up and talk a little bit about that. We're shifting our focus right now 100% onto the Medicaid unwinding to make sure that folks that will start to lose coverage May 1st under their Medicaid plans will have either be auto renewed into Medicaid or have other opportunities to get into a qualified health plan. So that's our big focus now. At the same time, Johanna is presenting to the House Government Operations Committee along with Commissioner Brain. So they'll both try and join when they get done with their briefings. And then Friday or Thursday, we're presenting to the Senate Finance Committee. Those are the two HGO Finance are our two big committees. So we'll have that this week. And then, as you all probably have heard, we have a new secretary coming in, Dr. Laura Herrera Scott. We've talked to the transition team and we will be meeting with her in the near future. And I've already alerted them that there is a board meeting in February. And Commissioner Brain has joined us, so thank you, Commissioner. So I'm going to stop there and let Andy come up and talk a little bit, a couple minutes on open enrollment. If you wouldn't mind, Andy.
Could I ask a quick question about Medicaid, the unwind?
Yes.
It's my understanding that in the past, we've had the false starts on that, but apparently this is a certainty because it's in the federal legislation
That's right.
that they've got to end it. And so
That's
there's some
right.
certainty to this.
Right, so what they did in the last appropriations bill, and I don't know if that's the right word, but what they put it in there, so they decoupled the funding and the,
Right.
yeah, so it's final now
Right.
with
Okay.
that date certain. Andy?
Talk about open enrollment. First, I want to thank the staff, board, carriers, stakeholders, the administration and the legislature, both at the state and federal level, policies they've put in. It's our 10th open enrollment. Next slide, and it was a record open enrollment. We enrolled 182,166 people. It's a new record in our 10th annual enrollment. It was up less than 1% from last year, 181,603. And Michelle just alluded to the public health emergency unwinding. There's more than 100,000 people on Medicaid as a result of the public health emergency. That exception is due to end beginning this spring, as the secretary just said. Many of these people who would not be eligible due to income will roll off Medicaid throughout the coming year. And there's an estimated 80,000 of them roughly, that number might change, that will qualify for federal subsidies for private health insurance. And we intend to contact each and every one of them in partnership with the Department of Health. So you can see how, we coaxed some growth out in the 10th year, but there's been a very big sort of side issue for all that the state, the nation has been through, and the world has been through in the last couple of years, and I think it will take a little bit more time till we unwind out of that. Slide. I think we made some progress on health equity. Black enrollment, race and ethnicity is an optional self-report, was 31,325, which was up 3% from a year earlier. Enrollment of Black young adults was up slightly, less than 1% from last year, held mostly flat. Hispanic enrollment was 22,106. That was up 9% a year earlier. And we could tell from the targeting we did in marketing that our conversions of the 50 million impressions that we had of stuff online, that we did very well with Hispanic uninsured and Hispanic young adults. In fact, enrollment of Hispanic young adults was 6,286, which is up 13% from a year earlier. So you can see that sort of like beat the trend in a big way. In fact, the largest growth of any income segment was Hispanic, less than 138% of the federal poverty level, which was up 16%. And overall, Hispanic enrollment has grown more than 20% in the past 5 years, actually the past 4 years, the exchange. So I think with a lot of different efforts from outreach and a lot of things that we've been doing, partners have been doing to get the word out, I think we've been making some big strides in a community that traditionally has been insured at a rate much lower than the general population. Renewals were up, new enrollments were down. New enrollments were down 14%, 34,205, and I'll talk about that in a second. Renewal enrollments were up 4%, 147,961. Our percentage of new as a percent of the total was actually higher than the other state-based exchanges, at least as they reported to the federal government through December. They were 12%. Those figures reflect 19% for us. But there's something going on, and we would actually obviously want to have growth in our new enrollment. So I think it's something to look at. But in the scheme of things, I think everybody had some challenges in that area. but our dental enrollments basically flat, down 2% from a year ago at 65,393. Young adult enrollments were on a par with a year ago. Enrollments of 18 to 34-year-olds were down slightly, but up slightly for that 26 to 34-year-old segment that we know is important because a lot of 26-year-olds roll off their parents' insurance if they can remain on them. And that total of 26 to 34s total 34,626. This, as you know, was the second year of a young adult subsidy pilot. It was funded with $20 million from the reinsurance program. 31,000 enrolled with the additional state subsidy, the lion's share of people who had enrolled. And they averaged about an additional $34.75 a month to help cut their cost of getting insurance. And about 6,000 of them were new customers. The only other thing I would add is you can see the trends in technology. Use of the desktop for MarylandHealthConnection.gov was essentially flat, but use of the mobile was up 6%, and use of the mobile app was up double digits. In fact, last year, people who used the mobile app to submit 25,000 documents. This year, they used the mobile app to submit 40,000 documents. So I think we've been on the right track of meeting people where they are in their use of technology to adult. So I think we're very pleased to have set a record in the 10th year. We know we have some challenges, as Michelle mentioned, certainly some challenges with the unwinding. If anyone has any questions, I'll be happy to take them.
This is
Are there any
Mary.
questions? Wait a minute, are there any questions in the room? Ben?
Thank you very much for the presentation. A lot of things changed on the marketplace this year with differences in premiums. What was the most attractive plan, et cetera. Did we get any feedback from consumers on surprises about what their premium level is? Those were subsidized. I'm most curious about, because it did seem as though from just kind of conversations I had with people who were buying on the exchange that some of them had some surprises on the jump in their premium out of pocket. So I'm curious about anything systematic that we learned so far.
We'll still, thank you, Ben. We're still trying to digest the numbers. A lot of them have been, being fastly fed to us. But I think one thing that was surprising was there was much more growth in unsubsidized populations than in subsidized populations, which, I think struck us as interesting, being that all the attention that had been paid to the Inflation Reduction Act of continuing the rescue plan subsidies put in place 2 years ago. So, but there was definitely more growth in the unsubsidized pool.
And the renewals were higher. Our renewals this year, which, that's the automatic renewal, so people are sticking with their plans.
Anyone else in the room? You put up the call-ins on the screen. Mary Jean, did you have a question?
Yes, I do. Andy, as we get closer and closer to full enrollment, it becomes harder and harder to get those incremental increases in population. But any sense, and it may be too early to tell, where we are in terms of sort of uninsured percentage versus how much is still left of that uninsured population to tap?
Yeah, thank you very much for the question, Virgie. Compounding the problem is the fact that the pandemic threw a curveball into the ability of the professionals to survey populations, so people answering their doors or answering their phones. So there really has not been a solid update in the numbers of the last we knew was 6% for Maryland that the federal government has put out. There's been some caveats in sort of what they've put out since. If you look at the census numbers from last fall, the American Community Survey, Maryland gained nearly 2% in the people in public health insurance, that is on Medicare, Medicaid, those programs. They lost nearly that amount in private health insurance, probably because of job loss and different things like that. So there's definitely been a huge shakeout through this thing that we've been through. pandemic we've been through, and I think that's still shaking out. So I haven't seen a great change to that 6% number or anything we can hang our hat on right now.
Thank you. Anyone else online?
Yeah, Singh Taneja.
Singh.
Somewhat related to what Mary Jean asked, we were looking at the uninsured population a couple of meetings ago. And in some of the Maryland rural areas, the uninsured population was much higher, 10 to 12% versus some other areas. During this new enrollment period, have we seen a growth in enrollment from those areas? We were trying to make a bigger difference in those areas.
We're still crunching those numbers, saying, looking at the map, it's up and down. I think there are some areas that had some growth, but other areas that had double-digit declines, including in the rural areas that we still are trying to figure out. They may have had increases in the Medicaid enrollment. So I think there are a lot of things that have gone on through the public health emergency that I don't think we'll be able to get a picture back to where we were pre-COVID for another year or two. And I look forward to being able to do that.
Thank you.
Question, Dr. Allen, you said.
Uh,
On the state or the uninsured.
Commissioner Brain.
Just two thoughts quickly. I think the first thing is that we all know that to some extent there is ARPA, and the subsidies that are being supplied by ARPA are helping to keep people renewing. And we don't know what's going to happen in 2 years when ARPA goes away. So I think from a planning perspective, that's going to be a cliff. I expect we'll probably have a commission, that will be addressing sort of holistically, what's going to happen as we move down the future. But for the exchange, I think planning for how do we ramp up in a different way when ARPA goes away and the affordability issue becomes more acute is something we need to probably start thinking about sooner rather than later. And the second thing is that I think when you have the data in, it would be very helpful to have a presentation with sort of a kind of a micro analysis of who, to the extent that we know, the uninsured are from a variety of demographic factors. So just those two comments.
Thank you. Is there anyone else online who has questions or comments?
No. Dr. Singh and Commissioner Bahrain actually covered the items that I wanted to discuss.
Thank you, sir.
I think Dr. Allen's asked where the uninsured are in raw numbers. They're most heavily in the population centers. So Montgomery and Prince George's County. In proportional numbers, Southern Maryland, Western Maryland have some of the higher rates of uninsurance. And in raw numbers, the large population counties such as Prince George's and Montgomery and Baltimore.
Anyone else? Thank you. The next item on our agenda are the board reports. The Policy Commission, Dr. Allen.
Actually,
Okay, Dana.
Before I start, I'm not sure if everyone online approved the minutes with the correction that I gave, and if the person taking the notes caught that. So I just want to check to make sure that was.
What we'll do is we'll come back to it after your presentation, after
All right.
The reports presentation. Thank you, though.
Let's see, the policy committee met on January 4th to discuss provisions of the bylaws relating to an advisory process committee. The committee also discussed board meeting frequency and whether meetings should be virtual, hybrid, or in person. Committee is making good progress getting through our review of the bylaws, and we look forward to presenting recommended updates to the bylaws for board discussion in the coming months. One specific item from our most recent discussion that I'll mention now is that the committee thought there would be a benefit to the board making the June annual board meeting an in-person meeting at a rotating location around the state. This would allow time for board training and relationship building and engaging local residents and legislators at the location of the meeting. Staff will put together a proposed agenda and review it with the board chair and the board for consideration in advance of the June meeting. Thank you very much.
Are there any questions for Diana in the room? Online? Next presentation is on the finance and audit, finance committee or finance and audit? Or don't we have
It's an audit.
finance and audit? Same Tanisha.
Thank you. You know, we missed the earlier part when we could not hear the sound, but I want to thank the secretary for your service to the exchange and to the Maryland residents. Thank you very much, sir. Excellent. The Finance Committee met on December 12th, and just one item I have to report is we reviewed the financial statements and we are within the budget, generally speaking. The one item that I would like to report is related to our procurement process. Earlier today, we received an excellent briefing from the Vice Chair McCann. This document talked about when the exchange started some years ago and the challenges we had at that time, from that time through now, when we are a mature organization, and the process and the progress that we have made so far to bring us to this stage. So my notes that I'm going to be speaking about are, so I think the Vice Chair, that was an excellent summary, I must say that. My notes are more getting into a little bit more into the weeds, if I can put it that way, because we have received many allegations, and I thought it was critical for the board to be made aware of those. And then from the most recent allegations, I'm going to ask Andy to come and give us an update of what the management's progress that, not the progress, but the management's plan is of the corrective action from that most recent report. When I look at the history, or I created an inventory of the procurement issues and allegations, going back, we have legislative affairs audit findings in 2015. We had audit findings in 2017. There was an anonymous complaint in 2017, another one in and I'm going to go over some of the details afterwards, after I go over the list. Where in 2017, there was another complaint in 2017, another one in 2017 by, I think an exit interview by a staff member. There was another complaint by a staff member in 2018, another one in 2018, another one in anonymous complaint in 2018. There was a confidential internal investigation in 2019. Then there was anonymous complaint we received last year. There was a follow-up anonymous complaint we received last year. So this is a long list of the allegations that we have received. And the nature of these allegations is irregularities in the IQ procurement process, steering contracts through predetermination of selected source, nepotism, retaliation, ineffective oversight, corruption. You know, the exchange has about 100+ master contracts with 150 individual resources at a cost of about $30 million a year. So that means there are many individuals involved, and I'm sure there's always somebody always unhappy, and that, gives reason for them to come up with their allegations. I won't be surprised that happens. Some of the examples of the allegations were procurement and again, what I'm reading is right from the allegation. They are not my words, but they are from the documents the allegation documents we received. Procurement malfeasance.
So can I ask sorry to interrupt you, Singh, but so rather than doing this, you know, most of these have been addressed in past years and corrective action plans. So I'm not quite sure what listing all of these old things is accomplishing. Perhaps you can help me and the rest of the board understand, because we have some more recent ones where we have a corrective action plan and they were found to be, there were some deficiencies that are going to be corrected and other things that were unfounded or couldn't be investigated. So I'm not quite sure where you're going with this. If that
Sure.
was,
So after I go through this, I will come to that as well. So there were consultants, again, back to the allegations, are being hired to work in IT, even if they don't have a proper education, certification. The IT executive refuses to hire qualified US citizens or permanent residents available in Maryland. 84% of the IT staff is foreign consultants. The staff is being handpicked. The contractors believe that there are no checks and balances in the recruitment process. When auditing, monitoring executive financials, and this is ethics reporting, there was, discussion about the ethics reportings. So the list is long. So now I'm going to come to the actions taken by the management. So reported to Attorney General, OAG's office, most recent complaint was reported. They have been shared with the Office of Legislative Affairs. Internal investigations were conducted. We have adjusted internal procurement processes. There was an issue of paid overtimes not being paid, and that was properly paid. Staff provides annual certification to various auditors stating that staff has no knowledge of instances of fraud, non-compliance, or suspected non-compliance. And of course, as you mentioned, Marijan, there are times when the report indicates that there were issues were found for which the office lacked capacity or the resources to follow up. That means there were some issues beyond the investigative capabilities of the staff. So from the board role or action, from my perspective, the board be aware of the actual or the reported procurement issues, be aware of accusations of fraud and abuse, receive the information and do nothing, or do something such as designate someone to actively seek OAG review, because they have had this for now 9 months, but no one knows what is happening, if anything at all, or are relying upon us for the internal investigation. Seek another branch of state government to conduct an independent audit. Seek independent assurances by engaging an independent auditor that reports to the board to investigate some of these allegations, especially the ones where management felt they did not have the tools to do it, or explore to follow or become part of contracting process that has a role by state bodies, such as the Board of Public Works or the Board of Contracts. We spend over $30 million a year on this. And I'm surprised that the Board of Public Works or some other bodies not part of it. So these are the kind of things that the board can consider. It's up to the board. I wanted to bring this information to the board, and board can discuss it and decides to do something or not do something. Purely that is the board decision.
Are there any questions or comments with respect to Singh's assertion?
Vice Chair, if I could, thank you, Singh, for bringing this to the board. I think my parting advice to the board is to go up 10,000 feet from this specific issue, because I've been a little concerned going back to the call center issue that's been out in front of us, is that, and now, of course, this issue, is that I've been surprised, and I was at a Board of Public Works. I go to the Board of Public Works frequently. And we're scrutinized by the Board of Public Works at the Health Department, as other agencies are. But there was the Stadium Authority was at the last Board of Public Works, and they were going through their contracting procedures with the Ravens, and they're very similar to us. They have a board of directors, they have a chair, and they have a massive operation they're responsible for. And so I've been wondering, since the call center situation, that we, the board, have taken on an awful lot of responsibility on our shoulders, which means that, you know, we don't have the Board of Public Works oversight. We don't have the Board of Contract, what do you call it, review that could be used. And therefore, whenever there's a problem, I kind of liken it to flying a plane as a pilot. You know, when it's straight, when the good weather is out there and you're flying straight and level, it seems easy. When there's storm clouds and you get yourself disoriented or into a big problem, that's when you better have 5,000 hours of stick time. And so I'm a little nervous, and I'm going to be leaving the board, and I leave this to you all to think about. We ought to really go back and review our policies around procurement, because we have really actually taken on a huge amount of responsibility on our shoulders. And when these problems come up, we are the ones solely responsible for this. So I just throw that out there. I think we have to be very deliberate. I think management has done a very nice job. We'll hear in a minute from Andy about the compliance report and the corrective action plan. But I think there's a bigger question here for us. So I'll turn it back to you, Mr. Vice Chair.
Thank you. Before we turn, first of all, are there any other questions or comments on Singh's report? Thank you. Before we turn to Andy, I sent today, as Singh mentioned, a series of comments to the board, and what I want to do is I want to summarize those for the public record, so that the broader community can a bit understand my own views as to where we have been and where we're going. Remember at the outset, we're going to go through a little bit of history here. Remember at the outset, both in the federal system and in the state, in 2013, when we flipped the switch for the exchange to go on, it collapsed. And very quickly, the leadership at that time moved, as they should, to adopt, in this case, the Connecticut system, lock, stock, and barrel. They adopted it using sole source procurements, and they adopted highly proprietary software. By 2015, which is when I came on the board, by the way, I'm not making the argument I made any difference. We had already made the decision to move away from that and to develop a system based on open source and on new contract. And the point I want to make here is that process is not simply one of switching out one part and adding in another. It is a complete change of system. It is a complete change of system. The analogy I used in the paper was it's like taking a 2015 Mustang and trying to put the drivetrain of a 22 Tesla inside of it. It's a very complex system, and we did it while we were still, in effect, driving the car. And the point I want to make is, A, we did it without any upset, without any loss of involvement. And these older complaints, which seem to indicate that there was some sort of a diminution, a dilution of the effectiveness, of the expertise, of the quality of the people we hired. We would not have been able, first of all, to do the first of these activities if that were to be the case. But there are, in fact, other factors to keep in mind. While we are doing that, first of all, as Andy mentioned, we made the transition, if you will, from a focus on desktop computers and laptop computers to these things, which I'm still having trouble understanding. But the process is more than just shrinking a website onto a screen. Inside this damn thing is a completely different set of guts. And so the software and the hardware, the software that needs to be put into place for this is entirely different from what was originally assumed. And we had to make this thing so that the people we want to use it will use it. We had to make it common. The term I use is a 1950s term, cool. But the point is that had to happen while this other stuff was happening. Similarly, we've all been around enough to remember MD Think and the issues there. That had to occur while this other stuff was occurring. And finally, COVID had to occur while this other stuff was occurring. Now, my point here is not that Subi and Venkat, we should put them on a pedestal, although we owe them a great thanks. But rather that if the kinds of allegations, which parenthetically were never upheld, were in fact true, then it would have meant that we would not be able to do this. It implied, and in fact stated, as Singh mentioned, that we were hiring people who were not qualified. If that were true, how does one explain what we have accomplished? So my first point is that, but now with respect to the specifics of the case, the two primary specifics outside of procurement were that we were steering contracts and that we were involved in that there were certain kinds of repression or repercussions for people who were to complain. The compliance officer could not find support for either of those two propositions in her report. The second, both the complaint and the procurement and the investigation found that there were shortcomings in the procurement process. Now, keep in mind, the CIO has no procurement authority. The complaints here are about procurement. And I'm here to say that it is my belief that we have a procurement officer who is a strong professional, and we have a strong procurement staff. And when you make the arguments that have been made, and when the complaints are lodged that have been repeated here, you are criticizing the procurement process, not the IT process. A third element just to keep in mind, by the way, while all this is going on, is we also had to deal with COVID. And you had all of the technical changes that had to occur with respect to eligibility, open season, and so forth. So my real point here is that that these activities, first of all, have not been upheld. But secondly, and now going on to the other part, we have a set of complaints with respect to the procurement process, as we had previously. My view is that the primary responsibility of management is stewardship of resources, stewardship of dollars, stewardship of people, stewardship of any resource that they are providing. And they are the ones that we hold primarily responsible. If we have to go outside, we need a new management team, and we don't. So my view is, first of all, we have a mechanism. It is in place. The compliance officer reviews complaints that come in by a various set of means. If they and the team, a management team, determine them to be effective or valid or questionably valid, we have a mechanism of going through and identifying corrective actions, and we're going to hear about it for these two complaints coming up. And then after that corrective action plan is adopted and put into place, the compliance officer's team reviews it in one way or the other, and I'm frankly going to have some suggestions next time about strengthening that process, but it is in effect now. But I also want us to keep in mind that this board is improved. The discussion earlier would have us believe that we didn't know any about this. The fact of the matter is, first of all, just to give you some background, every time that the compliance officer has reported to us, she reports on somewhere between 4 and 8 audits going on at any one time. We have audits at this as a state exchange. We're audited by the Office of Legislative Audit, CMS and HHS, DOJ, IRS because of our access to personal information and income. So all of those are going on by virtue of us being a state exchange. But most of our dollar activity is Medicaid. We are a grantee of the Department of Health and Human Services. The primary Medicaid agency is the Department of Health. Under those circumstances, we are under the authority or we can be reviewed by the Department of Health's Inspector General or the Department of Health and Human Services Inspector General. And we are audited by both of them, again, by the Department of Health, by the Department of Legislative Services, by the Department of Health and Human Services by virtue of our Medicaid activities. The board approves all large contracts, as we will today with these IDIQ contracts. The board in our materials, every session, receives a list of contracts that have been awarded. The board, every session, receives a list of IDIQ contracts that have been let. The compliance officer, every quarterly report goes through each of the complaints, tells us what is going on, tells us where we are, tells us about privacy violations, tells us about each of those. They are dense, I know. It is sometimes hard to continue to pay attention, but if you look back at the quarterly reports of the compliance officer, the material is there. Now, I'm not here to say we're perfect, but we have a system by which we are notified of information. We have a system in which we have a process in place to fix it. We have a plethora of people looking over our shoulder. We notify those oversight agencies either by virtue of the audit process or other processes of most, if not all, complaints that we have that we can the least bit justify. So that I think we need to understand where we are before we want to add another layer based on a set of allegations which have not been proven, and in many cases, which have been dealt with now through corrective action plan. With that, if anyone has any other comments, I'd be willing to have them now. Hearing none, Andy, the floor is yours.
Thank you, Jim. I'm here in the capacity as acting chief compliance officer. Until a couple of moments ago, I thought Michelle liked me, but now Singh, thank you very much for your comments. And let me put some of it in context as well. If you're going back to FY 2015, you're talking about 8 fiscal years. In that time, probably more than 120 complaints have come into the hotline. If more than a dozen of them, most of them having nothing to do with IDIQ or IT. If more than a dozen of them have concentrated on IDIQ and the resources, that's understandable, being that 1/3 of the budget of the agency and 2/3 of the staffing of the agency are directed in that area. It seems disingenuous to me if all of those cases have been looked at and have been found to be either unsubstantiated or partly substantiated and corrective actions put in place to repeat the allegations and the complaints, seems to have negated the purpose of having investigated. That is not me defending my findings. These are the investigations conducted by the prior chief compliance officer, found it to be either unsubstantiated or partly substantiated. And on top of that, as you mentioned, the auditors, various auditors have privy to that hotline and to the various complaints, have looked at them themselves, as well as our statement that we're unaware of anything that they need to be aware of in that area for us to sign off on any audits. So I just want to put that in perspective, that just because an allegation or a complaint was made does not mean that it was truthful or stood up to examination. That said, there were some partial findings regarding the procurement that we looked at. And let me go over sort of what the agency is doing in response to that corrective action. So we looked at 3 different buckets where we decided we needed to strengthen procurement in terms of the IDIQ specifically. One bucket had to do with interview panels, review and reporting. And the 4 actions that we're going to take in that area are determine and consistently adhere to a policy regarding the size and personnel makeup, request for response evaluation panels. Second, panels should review request for response financial proposals before reaching final selections. 3, panels should review memoranda of combined financial and technical rankings before reaching final selections. And 4, in that area, panels should record why candidate was deemed not to meet minimum or preferred technical qualifications, even if it's just a brief comment on that. Second bucket under procurement officer involvement. The agency procurement officer should determine the need for a best and final officer, a best and final offer. Also, the evaluation panel chair should inform the procurement officer of the selected awardee. And the last bucket for the corrective action plan has to do with master contractor ownership information in accordance with Maryland Code, State Finance and Procurement Article 13221. And for that, we're recommending that MHBE document and implement a mechanism to ensure that all vendors follow the State Finance and Procurement Article 13221. It requires that if a business enters into an agreement with the state agency and is to receive at least $200,000 in a calendar year, the business shall file with the Secretary of State a list of the names and addresses of the resident agents of the business, each officer of the business, and each person who has beneficial ownership of the business. Also, this is a requirement for all procurements. It should be built into the request for responses and request for proposals and verified by the procurement office when accepting proposals as responsive. Some of these are already being put in place. Our new and very skilled procurement officer has been part of the IDIQ process since the summer as it has rolled along for the upcoming IDIQ. And there'll be a meeting internally in 10 days where we continue to lay out how we will put these 8 steps in place. Are there any questions?
First of all, questions in the room? Questions online? Hearing none, do we need to approve this one?
I don't think so.
Okay.
I do have a
Yes, go
question.
ahead.
The purpose of the state requirement to list all the people and their addresses is to check for relationships, conflicts of interest? Or is that just because, I mean, I want to know why that, I mean, I personally think why it's important, but I want to hear the official reason why that's.
Yeah, I don't know if I should if Sharon, if you would have any comment regarding the
It's a state finance article.
regarding the state finance article. Dana's question about why addresses of and
Names
business.
and addresses, and is that home addresses, residence addresses?
So I don't know the actual purpose for it. It is a requirement that all, as Andy said, that all procurements over $200,000 are required to give that information. So it would make sense that it's also for conflict of interest. It's for the state to know exactly who they are contracting with, because sometimes with these corporations, you don't know just by looking at the initial documents that they provide or who are the underlying owners of the business. There's also a requirement that that the businesses, you have to find out if they're debarred or if any of the owners are debarred and things like that. So it's really just to check to see who owns the businesses.
But the kind of part of the vetting process, maybe?
So
Or is,
I won't say it's part of the vetting process because it's an ongoing process, right? And the timing of it isn't necessarily before these contracts are signed, because sometimes you don't know that a contract is going to be over 200,000. But that information is there so that if for any reason, the agency needs to check on conflicts of interest, on whether a business or a individual owner of a business has been debarred, that they have the information to do that.
one more question, I'm not sure if it's for Sharon or for Andy. If going through this process and let's say someone notices the same name, different company, same residence or whatever, or different names, but same residence. Oh, dear God. And therefore there may be a conflict of interest. Are the businesses required to be transparent and say any possible conflicts of interest, or someplace, does it say any conflicts of interest? Yes, no, or whatever.
So in the procurement process, there is a requirement for the vendors to disclose any conflict of interest. I can't say sitting here that just because there are two vendors that are related, that is a conflict of interest, but they are supposed to disclose conflict of interest, and it actually is defined in one of the documents that they sign off on.
It's helpful.
I'm only gonna suggest at this point that one of the things I'd like to see added was that a copy of those filings be sent to us for contractors that are for us. And I don't know, I'm only suggesting because I don't know what the volume is. But at some point, maybe we want to have a database of our own. It says here, because it's public record, right? These are public records
Yes.
that we would keep so that we would understand that so-and-so and so-and-so are both on these two contracts, and then contracting officer, maybe the Wizard of Iz, Venkat can put together a mechanism that automatically tells us when there's a duplication, and then we can raise the question with them, and then deal with, again, the issues that's being raised. I'm not gonna, I don't know what I'm asking for, so I'm not gonna push it, but I do recommend it. Now, any other questions or comments?
Dana, sir, may I? So Dana, you asked the question about the $200,000 and I just Googled it. So the answer is that the law was passed in 2015 to report any pay to play, meaning if those individuals who have contracts worth 200,000 or more, they have to report that as well as their political contributions. So that was the reason it was done, so that individuals who are making contributions and there's no hopefully there's no relationship between that and contracts over $200,000. It's a pay to play law.
Other questions online?
So,
Kathleen, are you, I'm sorry, Kathleen, I didn't see your hand up.
no, that's okay.
Mr. Bray.
Thank you. I just wanted to make it very clear, and I think I speak for all my fellow board members when I say that we are absolutely 100% open to any concerns that any individual or consumer has with regard to any of the activities of the exchange or the board. There is a process in place where people are allowed to bring their concerns forward and make complaints. And those are things that I wouldn't say we necessarily welcome them, because we don't want that. We don't want people to be upset or concerned and have complaints, but please understand, and just to make it very clear, that your complaints are going to be handled thoughtfully and carefully. There's no defensiveness, there's no resentment about the idea that complaints, this is part and parcel of being what is a public entity that is doing the people's business. And so I just, from a tone standpoint, want to make it very clear that, you know, the discussions we have been having is mostly about making sure that you feel sure that that when complaints are raised, they are being subject to a very thorough scrutiny and evaluation, and oftentimes involve transactions that have already been the subject of much scrutiny and evaluation. And so I don't want anyone to ever feel as though there is any sense of or any hesitancy about bringing to us any concerns that individuals might have, because they will always be taken respectfully and thorough, and will be reviewed and considered dispassionately and thoroughly through all the right channels. So I just wanted to make that clear as part of the broader discussion of where we've wound up with regard to some of these particular matters, that this is in no way ever intended to suggest that people shouldn't feel free to bring their concerns, you know, to the board through the right mechanisms when they exist.
Thank you, Commissioner.
Thank you.
Yeah, Reggie, do you have your hand up, or is that just your?
Sorry, I needed to elevate my hand.
I got you.
Sorry.
All right.
Wasn't
Secretary.
raised. for comment.
Yeah, I assume we've covered everybody online.
Yes.
I just wanted to piggyback on top of what Kathleen Borain was saying. I think the tricky part, I mean, and board meetings are designed for board members to talk to board members. We receive briefings from staff, which is, you know, the way we get information, but this is really our time to talk. And unfortunately, or fortunately, depending on how you look at it, we are a public board and we were Open Meetings Act, so we have to talk about this stuff in public, which sometimes makes it a little uncomfortable, which is fine. You know, I don't have a problem with it, but I think we can't be reluctant to have these conversations. And when a board member wants to bring something up, we got to talk about it. I think I'm really grateful to the staff for the corrective action plan. I think I'm a big believer in due diligence and internal controls. I think what you addressed, Andy, are maybe some weaknesses in our internal control structure, which we have to tighten up. But the challenge always is that you have to constantly be reviewing your internal controls, because that's where sometimes when things break down, if there's a bad thing that happens, we in the board will be having a much more public discussion, which has happened in the state. And then we are personally, so I'm always worried about my personal reputation. I sit on boards, and most board, you know, members who are asked to be on a board will do their due diligence to say, is this a board I want to sit on? Because my personal reputation might be at stake at some point. So those are the things that I think we really got to think about. The 9 of us, 3 of us are administration appointees. We sit by position, and the other 6 are appointed by the governor. So I think these are really important conversations for us to have. They can be a little uncomfortable, and I think I have to applaud the staff for coming forward and taking this seriously, working through the finance committee. But I think this is part of, given the responsibility we've taken on with the way the procurement process works in the millions of dollars, we really don't have a lot of choice. I think this is a burden we have to bear. Anyway, that's my
Other
final-
comments? Thank you. Final plan certifications, Becca, I think it's you.
I think actually Johanna is with us.
Oh,
so
Johanna is with us.
Oh, great.
Then if she's having IT issues, then I'll step in, but I think we have Johanna here.
Why don't you come up to the table
Yes.
anyhow?
Oh.
We'll see you.
Hi, can you all hear me?
Yes, we can hear you.
Okay, great. Cynthia, are you handling slides? Yes, I see they're pulled up. Wonderful. So I'm happy to be presenting on most of our final 2024 plan certification standards and bringing them here for a vote by the board. We last discussed these at the November board meeting, and just a reminder, we followed our normal course of business where we shared these with stakeholders, including our standing advisory committee in the fall, presented the proposed standards to the board in November, had a public comment period, and are now bringing recommended final plan certification standards to the board for a vote today. The exception is our updated value plan standards for 2024. I'll get into this more later in the presentation, but we're having an additional public comment period on those due to changes we made when the federal actuarial value calculator for 2024 came out. So because we want to be able to get that additional public comment on those changes, we're not bringing those to the board for a vote until February. But we've been coordinating closely with the MIA, and carriers are aware of this. So we're working with all affected parties. Next slide. So the first proposed standard for 2024 was to include a link to the actual plan contract in the summary of benefits and coverage. And just a reminder, the summary of benefits and coverage is a federally required template summary document that summarizes your plan, as the name suggests. And at the top of that summary document, there's a space for the insurer to provide a link to the actual plan contract where you can get into the real nitty-gritty details of what your plan coverage is. Currently, we're seeing some carriers, in some cases, link to a template document rather than the actual plan document. And so we'd like to require that carriers include a direct link. You don't need to kind of click around. You can get directly to your actual plan terms through that summary of benefits and coverage link. The only comment that we got on our proposed standards that I'm sharing to you today was in relation to this from one of the carriers, saying that they had some timing considerations for when they would be able to get this up and running, given when they get approved forms. That's fine, and we communicated with them that we're happy to work with them on implementation timing as we roll this out in 2024. But other than that, we did not get any comments on the proposed plan certification standards that I'll be sharing today, which I think speaks to the fact that we did our due diligence in running these by stakeholders in advance and making sure that they were feasible to implement. So that's the first item. The second proposed plan certification standard, and we can go on to the next slide, Cynthia, is to require NCQA health equity accreditation. Again, this was a unanimous recommendation of our health equity work group, which included the carriers, providers, consumer advocates, brokers, all of our kind of stakeholder groups were on board with this. And so this would be a requirement again for 2024, but with some timing acknowledgements that existing insurers have some similar kind of predecessor standards and are in the process of transitioning to this new standard. So we would work with them on that and work with new issuers who may join the exchange in the future on their timing. And then the last proposed standard that we shared in November and then are bringing to you today is a plan certification standard for vision plans. Again, no comments on this, no changes in what we're proposing from what we shared in November. These would be standards for vision plans being offered in partnership with the exchange starting in 2024. As a reminder, all of our plans already include pediatric vision benefits. So these vision plans, standalone vision plans, would be adult benefits specifically. And these standards were informed by the request for information we did over a year ago. And as I mentioned, no comments on these. And then the last item that I wanted to share are the changes I referenced that we made to our proposed standard plan designs. And again, we're not seeking board approval of these today. We'll come back to you in February with final recommendations. But just wanted to share with you where we are in this process and the changes that we have out for public comment. As I mentioned, the 2024 Federal Actuarial Value Calculator came out in December. This is a tool that the federal government requires that all plans use to determine the actuarial value of their plans. And again, actuarial value, or AV, is a measure of the generosity of the plan, of the portion of claims that a plan covers. And in order to fit into each of the bronze, silver, gold, platinum, metal levels, you have to have an AV for that plan within a certain range prescribed by the federal government. So this calculator is the tool the government provides to figure out if you're in that range. When the work group was developing our proposed plans for 2024, we only had the 2023 calculator available to us, so that's what we used. We anticipated that when the 2024 calculator was released, we would probably need to make tweaks. This is common in the market, that tweaks are made each year to maintain compliance with the calculator. So the next slide gets into, at a high level, what those tweaks are. So we can go on to the next slide. So we had, back one slide, please. There we go. So we had 3 of our 6 plan designs were too generous when we ran them through the AV calculator, the bronze plan and 2 variations of our silver plan. The first action that we took to adjust the plans to try to bring them into compliance was to increase the maximum out of pocket. That's the most that an individual has to pay in out-of-pocket costs in a year before the carrier starts covering 100% of costs. So that out-of-pocket maximum is federally set, and it inches up each year. Changing that is the easiest way to adjust AV because you don't have to touch co-pays and all the other details of plan design. So that's where we went to first. Increasing that was enough to bring one of the silver plan variations into compliance. It helped with the other 2 plan designs, but it wasn't enough. So we had to go deeper into the plan design to make some additional adjustments for those other 2 plans, the other silver variation and the bronze plan. And the next slide shows what we came up with there. So we worked with the MIA to develop 2 options that would bring our plan proposals into compliance. One was to increase the specialist copay for these plans from $80 to $90. And again, these aren't all plans. The gold plans, other variations of the silver plans have lower copays than this, but for these particular plans, the specialist copay had been set at $80. So as I mentioned, the first option was to increase that to $90 and to increase the generic drug copay from $20 to $25. As a side note, it's a Maryland state law that an individual not be charged more than the retail price of their generic drug. So if the retail price is less than $20 or $25, for example, if it's $5, an individual would only be charged $5 for that. So this generic drug copay is capped, but individuals might be paying less depending on the drug. The second option was just to focus on the specialist copay, not to touch the generic drug copay, and just to increase that specialist copay from $80 to $110 for the silver plans that are affected, and then from $80 to $125 for the bronze plan. The first option was our recommendation because we felt like that second option pushes the specialist copay, over $100. That's a little bit of, that's rather a significant increase from $80 up to $110 or $125. And given also the generic drug protections regarding retail price, we thought that that first option was a gentler consumer impact. But we put these out for public comment. We shared them with our affordability work group and in general with the public, and are seeking comment on these through about the end of the month. And we would also welcome any board feedback on thoughts about these 2 options. I think the next slide just provides the more detailed overview of all of the copays under the plan designs, if you want to move forward one, Cynthia, but that's a little bit hard to read. So the prior slide really just summarizes the changes that we were putting forth for comment. Again, we'll be bringing these back with a final recommendation in February. And that's it for my presentation, but I'm happy to take any questions.
Now, are there any questions in the room? Ben?
Thank you, Johanna. So I did have a few questions on the co-pays for specialists. As you might be aware, there was a bill that the physical therapist put in last year that didn't pass. That was, I guess I would characterize it as a quasi mandate that tried to pay co-pays for physical therapy to primary care, which I don't necessarily endorse, but they are deemed typically specialists, and they argued that the co-pays that existed then, which were typically $50 to $75, were excessive and deterred care, since they would be deemed a specialty. I would anticipate that there would be more consternation among non-physician specialists about having these types of co-pays imposed on them. It's not like your cardiologist, for example, where you may be, they may be conducting a number of different tests, and the copay reflects a number of different services that may be performed during that visit. Typically, PT, OT, etc., is for a visit, and those copays do seem a little scary to me. Thanks.
I'm happy to address that. And this was actually a subject of conversation in the affordability work group. The work group felt strongly that physical therapy, occupational therapy, and speech therapy should be at parity with the primary care copay. So those are a separate lower copay that's at parity with primary care. They range from, I think, $0 up to $35, depending on your metal level. So those are not those are not included in the specialist copay category. Similarly, I will add mental health and substance use disorder outpatient visits are also at parity with the primary care copay and would not be included in the specialist category.
Thank you.
Anyone else in the room? Mary Jean, you have your hand up.
Yes, I do. I had a question about the generic drugs, because when I used to do plan design, making sure that people could actually take their medications was always a high priority, and making sure that we didn't price things out. So I will be really interested to know if you've gotten any feedback so far on the price sensitivity between $20 and $25, because we don't want to price anybody out of taking their medication and exacerbating whatever their health condition is.
Yes, we haven't got any feedback on that yet. We are kind of, sensitive to the generic drug copay. That was another one that the affordability work group prioritized to try to keep low. I will point out that for the gold and a couple variations of silver plans for lower income folks, that copay is actually ranges from $0 to $10. And if you look at our enrollment, we have about 70% of our enrollees in the gold plan or those silver plans for lower income folks. So those folks would all be eligible for the $0 to $10 generic copay, but folks in the bronze plan and the silver plans for higher income folks, that other 20 to 30% of folks would be looking at that $20 to $25 copay for generic drugs.
If I might just add, Johanna, the challenge we have, and especially as we're looking at our benefit design and through the lens of health equity, is that we have to meet these actuarial values established by the federal government. And so you can only, squeeze that balloon so many ways. So this has become a national issue. We're talking with our other state-based marketplaces, because especially in light of wanting to have drugs that are low cost and services that are low cost. So we've actually are putting in comments about really the federal government reevaluating this whole actuarial value, and is it still doing what it was intended to do in the beginning of the Affordable Care Act? So we're not alone in this juggling of trying to meet that actuarial value, yet deliver really high quality products.
Thank you. Singh, you have your hand up. Do you want to speak?
Just been up.
Sorry, that was from before. I should have lowered it. Thank you.
Okay, thank you. Are there anyone else? Is there anyone else online who wishes to speak? We are, I take it then, ready to vote. I move to approve the new plan certification standards for plan year 2024 as presented, with the exception of the proposed value plan designs, which are still pending public comment. Do I have a second?
Second,
Second,
Second, Dana, is there any further comment? Hearing none, all in favor say aye.
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 Opposed? The ayes have it. Dana reminded me that some of you were not online or able to hear when we did the minutes. So I'm simply going to ask, does anyone have any changes to the minutes? Dana gave us one change as to what she is the chairman, what she is the reporter for. But is there anyone else who has any questions or comments? And all in favor of adopting the minutes as amended, say aye. Aye.
Aye.
Opposed? The ayes have it. Back here, so I don't get our last month's record. IT procurement. Venkat, Sherelle, and Tracy.
Good afternoon, Mr. Chairman, Vice Chair, members of the board, and everybody. Mr. Chairman, thank you so much for your wonderful service, and thank you so much for helping us and encouraging and supporting all the technology initiatives specifically, and for being with us during I would say, a delicate time of migrating our system to MHBE platform, and your support was highly appreciated. And we do take your word of utility to our hearts, and from technology team, we strive our best. Obviously, we are not perfect, but we will continue to strive towards that goal in technology and everything else that connects with technology as well. Thank you, Mr. Vice Chair, for supporting the IT specifically and the technology and the agency as well. We do appreciate. I do really thank you from my heart as well. So today I am joined by our new procurement officer, Cheryl Gray, and I think Cheryl presented with Board of Public Works before, but this is the first time to present before our board. And we have two agenda items. One is the IT Consulting and Technical Services IDIQ Master Contract Approval Request to the board. And the second one is a heads up to the board about an upcoming procurement, which is a license renewal of our Salesforce contract. And we will come back to the board for approval on that particular contract. I will be joined by our procurement manager, Tracy Gamble, on the second second presentation. So with that, I just want to give a very brief introduction and hand it over to our procurement officer. As the board already is aware of, our technology systems are supported pretty much in-house. If I include MD, thing is some sort of in-house in the government part. And we, over the period of last 7 years, we migrated a lot of our systems from big integrators of providing our technology support, maintenance, operation, development, and also in the last few years, our system operation support as well. So we moved everything in-house, and more than 90% of our staff, IT staff, are under this IT consulting and technical services contract. And last year we had 98, last year, the current contract ending in June 30, 2023, has 98 master contractors, and more than 30% of them have a task order with us, meaning they provide support through their services as well. And also majority of the vendors are small and medium-sized businesses, and I think Cheryl can talk a little more about other information in detail as required. So with that brief introduction, I will be around, and for any questions, I will hand it over to Cheryl.
Good afternoon. It's a pleasure to meet you all, and I'm pleased to work with MHBE as the procurement officer. I'm just going to go over the procurement process that I did to procure these services, and hopefully you guys will accept my recommendation for award. This first slide is just the basic introduction. Is the IT consulting and technical support services resources are procured through the indefinite delivery, indefinite quantity, known as the IDIQ master contract. The current contract that we have now will expire June 2023, and our objective is to have the recommended awards and contracts go out to current officers April or May, so that we can have a start date of July 1, 2024. Next slide, please. Currently, we have 10 functional areas. These functional areas are the same areas that they've been using for the last 7 years, so it's nothing new with that, and we had a great response to fill those positions. Next slide, please. Here's a snapshot of the procurement process. We were very proactive this time around. We started in May last year to work on the RFP so that we have a solid procurement for our vendors. We posted that solicitation on Emma and MHBE's website October the 12th to November the 28th. When we had a pre-proposal conference November the 2nd, and it was transcribed by Hunts Reported. From November the 29th to January the 13th, the evaluation process started. We received 144 requests for proposals, so that was great. And out of that 144, we eliminated 29, so we yield 115 as our recommendation for award. Some of the things that made them not qualify for was basically not following instructions. Some of them didn't list the functional area. Without the functional area, you couldn't give us past performance, so there was no way to evaluate. After that, the procurement officer, along with the manager, presented those evaluations to the committee. Then we gave them the financial proposals. After the financial proposal was open, we did the evaluation process, and I did that personally myself. That evaluation process came with checking SDOT to make sure they didn't owe the state any money, making sure the references did check out for all offerors who submitted a request. What else did we do? That's about it. Now we're here, January the 18th. We hope to start sending out some of those recommendations for awards to the vendors, providing that they can send us back all the required documents along with their contract. Next slide, please. Here's our timeline. We have a 3-year base contract, right, with 2 one-year options. It was a competitive sale process for this particular solicitation, and you have the same numbers here. We received 144, we eliminated 29, and we yield 115. And I might add, the procurement officer, me, and my manager did go through all the technical proposals. So when the committee had to eliminate some of these vendors, we already knew what they were going to be eliminated for because we opened them up and saw that they didn't have, but it wasn't my call to make, right? Next slide. MHBE, I'm sorry, request the board to approve postmaster contract awardees to provide IT technical and support services under the IDIQ indefinite delivery, indefinite quantity contract, the base period of July 1, 2023 to June 30th, 2026, and for the 2 one-year options that we have.
Sherelle, will you just address that there's not money tied to these contracts at this point?
No, there's not any money. Right now, it's just a recommendation for award. We haven't did the financial breakdowns. Although we were able to identify who qualified for which functional areas, there is no financial drawing right now.
But the second part is that they would submit.
Correct. Once we get your approval, we will start doing the request for resumes. So we will contact the master contractors to ask. So we have a list of 10 functional areas. So now we're ready to procure maybe 2 of those functional areas. We'll reach out to that master list. We'll ask them to send us some resumes, and then at that time, dollar amounts come in, because then they have to tell us how much they're going to charge for that particular functional area that we're asking. And we're trying to do maybe 1 or 2 functional areas at a time. as need arises. But the objective is to have everything up and running by July 1st.
Are there any questions inside?
Just had one question.
Just go ahead.
So Cheryl, just a quick question. When we go out to ask for the proposals, your office
That's
will
for resume.
resumes, the RFRs, and I guess there were 3 items, RFRs, and then what were the other 2 items on the slide?
If we can go back to one.
Go
slide.
back once, go back a slide. Yeah, there it is. So issue the RFI, or select the candidates and issue the test. All of that's gonna be done under your purview.
Correct.
Okay,
And I'm a baby of Comark. Because I work
Okay,
for
good.
DHS, but I was gonna see Lotus here. but
and how big is your staff?
Well, I'm not the manager, but right now my manager is online. There's 2 of us currently.
2 of you. Okay.
Correct.
Your manager oversees.
Correct. He oversees what I do. Correct.
Awesome. Okay, thank you.
Ben,
So in the IDIQ RFP review process, are you seeing any resumes, hypothetical, illustrative, when you review the 144 and struck out 29? Do you know kind of what the bank of personnel is they're gonna be proposing? Or if not, what is it you're evaluating these firms against? If you don't see basically the personnel that are gonna be proposed.
Well, the proposal that they submit is very detailed. So in the RFP, we asked them to present past performances, companies that you've worked with, the services that you provided previously. So that tells us what they're capable of doing. And then we also have their references that I checked. So we know that if they asked for a functional RU1, they had to submit proof that they actually did those services. And to support that, they had to give us the name and reference for that particular company that they worked with.
Thank you.
You're welcome.
other questions in the room? Online, questions online?
Yes, sir. May I?
Yes, please. Sing.
Couple of questions. One is the start date for the new contract is July 1, and we are now 5 months away. With the 100+ vendors being selected, I'm not sure how many of these overlap the existing vendors. Are you anticipating a mass shift from, because the workers are still, working for us and they're part of the projects, they're in the middle of a lot of things. Are we anticipating a lot of shift from one vendor to the other, or a lot of new resources being introduced because we have new vendors being selected? How do you all see all that happening? I mean, there's a lot of movement.
So let me answer that too. So the answer to your first question is absolutely not. We're not going to cross reference or have a big shift because the current contract expires. No one will get awarded until July 1st. And we also not soliciting requests for resumes for all 10 functional areas at the same time. So just because someone is in a position now under functional area 1, if they happen to get a request for resume through a master contractor, they can't start that service until July 1 if they qualify, right? Just because you qualify once doesn't mean you won't qualify again. And in addition to that, we will select the best price most advantageous to the state. So if you're in that position, I'm just gonna give you a hypothetical, if you're in that position and your master contractor proposed $15 and we had a better one, same functional area, and they proposed 10, and the technical and the qualifications matched, then the one that proposed 10 will get it. Because that's most advantageous to the state, and that's my focus. And I will be sitting in on some of the interviews for some of these requests for resumes.
Other questions?
If I may, so in that example you give, that's a good example. So if we get a lot of those who have 10s who get it versus the ones who are presently getting 15, so that means shift will be occurring. People will be, the workflow will be disrupted because the ones who are getting 15 would be leaving and the ones who are getting 10s will be coming in.
Mr. Singh, if I can answer, then I'll let Cheryl. So based on what we saw in our prior IDIQ to this current IDIQ, some of the sub vendors were potentially employers of these consultants. If they become the prime vendors, we saw there is a shift. I mean, it's not massive shift, probably 10%, 20% max. And I think that is kind of expected, especially when an employer becomes the prime based on the prior 4 years of experience as a sub. But other than that, I would view this as an opportunity to always seek better talents. And it's not, sometimes it's not going to be exactly the same RFRs we issued 7 years back because the technologies change and the skill set requirements change. Our team constitution changes as well. For example, as simple as building a CI/CD pipeline, what we call for our deployment. That was not there 7 years back, and that's completely new, even though that can be coming under the same system operations type responsibility, but the technology is different. So we will be carefully looking at each and every RFR to ensure that what we require meets our current needs as well as our projected needs potentially down the line for several years.
And Cheryl, I just want you to, because you made a statement that if we look at it, we see the less price, we'd automatically take that. But that's not always the case. We look at qualifications and we look at price, and just the fact, and this is all our procurements.
Right.
The fact that something is the lowest price doesn't mean that's the one we always go with. We look at
Absolutely. The
qualifications.
technical and the financials have to match.
Just wanted to clarify that.
Yes, absolutely.
Just a very quick question. When we have a subcontractor on board, do we pay that subcontractor directly, or does the money flow through the the IDEA contract?
Goes through the prime.
How do we know what the actual compensation is of the contractor that we have in the house?
In general, we do not know. These positions are, I think several years back, CFO, with PMO conducted an initiative to ensure that the contractors are paid definitely well above the labor rates, minimum required labor rates. However, these technical positions, the rates have to be competitive for everyone involved, including the prime subs and the individual resources. So sometimes we do see for certain positions like senior systems architect, for example, definitely the person would be commanding definitely substantially than a junior programmer. So you would see, based on the trend again, you don't see much of subcontractor involvement in that, where you would always see a prime directly going for those contracts to meet their margin as well as the overall rate. And we also are very careful in monitoring the blended rate for our IDIQ, which is generally 20 to 30% less than the big integrated rates also. So it's a market that determines.
Understand my point, and I'll leave it at that. Are there any other questions as we're getting ready?
Yeah.
One more, go ahead, Mary Jane.
So to follow on to Singh's point, I'm a little concerned about the loss of institutional memory and the disruption as you end up switching contractors and making sure that that doesn't interfere with keeping the mission going. I mean, I've hired lots of IT contractors at various times and know that there's always ramp up time. I mean, you lose somebody who knows something and somebody else has to come in, no matter how well documented it is, has to come in and figure out what's been done and how it's been done, et cetera. Not to say that they wouldn't do a better job, but I want to make sure that we've got processes in place to mitigate any disruptions that could occur as we change out IDIQ contractors.
Thank you. That's a great point. Actually, we have certain systemic controls, meaning we are not tied to a specific vendor, number one, for core operations across the teams. And secondly, when we have started this process well ahead of time. In fact, once the board approves, once the procurement officer issues the master contracts, We have several months, so we will be starting to issue the RFR starting February, and that gives at least a 1 month cushion after everything was completed to reassure the staff, for the right staff, the qualified staff, to have a continued presence with the exchange.
Any other questions? Singh, do you have
Yes,
anything
sir.
else to say?
I do. I think we were discussing earlier that there were so many vendors we were able to disqualify in the process initially. So one of the allegations, if I can put it that way, but I think that was substantiated, was that in the present system, there were vendors who had financial interest in multiple contracts under, somebody under ABC name, CBS name, DEF name. Are we able to, in this process, isolate and exclude those so that we don't have multiple interest vendors showing competition with each other, but they're one and the same thing?
I'm not really sure what you're asking. Are you asking, is there any way to identify multiple master contracts applying for the same functional area?
Singh, let me, if I might, Mr. Vice Chair, let me see if I can interpret your question from what I heard. I think what he's asking is, are there, if you've got a bid from this contractor A, and then you've got a bid from contractor J, but they're really both the same ownership. Is that what you're asking, Singh?
Yes, sir. I was on mute. Yeah.
So he's asking, are you able to sort out if there are contractors who are really the same ownership for multiple contractors, but it appears as if they're competing, but they're really not?
I haven't come across that, and I've looked at all 144. So
Okay.
it's one, and I did to ask that. Now, can I say that Mike Joe is the same company that had Sunrise Company? Their name not on the ASTAT report, right? When I went to ASTAT, so there are two different individuals and they're two different businesses.
Yeah,
I've seen.
I think the real question, this gets back to Andy's report. Are we building in some internal controls to ferret out that kind of stuff? I mean, I've done a lot of contracting over the years. Contractors are very creative.
Especially IT contract.
Yeah. And you have to be on your game, particularly when you get into minority contracting and, who's.
I've seen my share so far.
Yes, yes. So you get my point. So I think that's what Singh is asking. I think saying, to be fair, what you're really saying is, are we implementing procedures to ferret that kind of stuff out?
Correct, correct.
Yes, and I think
Yes.
you mentioned within the next 10 days, we will be looking at that and head on meeting. Currently, and I understand that's a valid question, and I have seen my share of duplicates and name changes. But if they all worked out and they had different, and they were valid, they had SDAT verification and references checked out, then, currently it's nothing I can do. I can't just eliminate people because of suspicion, right? But to his question, we are trying to put some mechanisms in to see if we can identify duplicates. And the same thing would apply to the RFRs. If we see the same vendor and then the master contractor submitting the same resume for two different functional areas, then we know how to pull that. We can catch that because you can't do two jobs at the same time.
In the interest of time, if anyone has any other questions, let me then have us move on. Do we need, let's see.
Does this include the sales force? Or is that
Yeah, we need to
separate?
go to sales.
Yeah, let's make sure we don't miss the sales force. This one first. And, okay, got it. That was my question. Thank you.
I move to approve the vendors recommended for award as master contractors under the IDIQ indefinite delivery, indefinite quantity contracts for IT technical support and services support for the base period from July 1, 2023 to June 30, 2026, and 2 one-year options from July 1, 2026 to June 30, 2027, and July 1, 2027 to June 30, 2028. Are there any other questions or comments? Hearing none, all in favor say aye.
Aye.
Opposed? Guys have it. Salesforce.
Thank you, Mr. Chairman. and the board. The next on the agenda of the Salesforce license renewal. This is heads up to the board, and we'll come back. I'm joined by the procurement manager, Tracy Gamble, online, and we will come back next month to request the board, but just to give a heads up. Salesforce platform has been with us for several years. In fact, when we started 5 years back, it was just a CRM solution, which is again significant solution for our call center. Every phone call that our CSR, the consumer call center representative, takes is documented in the CRM system. And however, over the years, we leverage the same licenses and the platform to build many applications, as you can see, many internal applications like tracking the time for our consultants, or working with carriers and producers, and integrating our systems with the HBX system, and recently integrating with our live chat. And also we have built a portal for appeals, and next year, this 2023, we are expanding our privacy and incident management system for compliance as well. So this is a very critical application for our exchange, and we will be requesting an extension of our licenses by 1 more year. I will stop at that, and maybe I'll request Tracy to continue with the next slide.
Good afternoon, Mr. Chairman, Mr. Vice Chairman, and committee board members. Happy New Year. Okay, so as Venkat stated, MHBE entered into an intergovernmental cooperative purchasing agreement with Carasoft back in March of 2021. And that was for 1 base year and 2 option years. We've started the process for the 2nd option year, and we will actually come back to the board on next month with our actual award. Now, in 2022, Cynthia, if you could go back to 1 more, right here. In 2022, our Salesforce cost was $1,167,000. We anticipate in 2023 a decrease to $1,111,010, and that being because we decreased our Service Cloud Enterprise Edition license by a quantity of 40. So we'll be saving $55,990 in 2023. Next slide. Next slide. This slide basically gives a summary of the last 3 years' costs. In 2021, the agency spent $1,166,999. In 2022, $1,166,999.06. And we anticipate in 2023, $1,111,009.89. And as stated, we'll be back on February 20th for our recommendation for award. Are there any questions?
Mr. Secretary.
Yeah, I just had 2 quick questions. The Carasoft agreement with Intergovernmental, who is the intergovernmental contract sponsored by?
GSA.
Oh, great. Okay, that's very good, actually. Okay, and then the second thing is we're just contracting for the licenses for Salesforce, not the wraparound services to develop the processes. Is that correct?
That's correct.
Okay, all right, good. Thank you. That's all.
You're welcome.
A quick question, is the savings due to the fact that we're some of this activity is now over in MD Think?
That's a great question, Mr. Vice Chair. Actually, over the years, when the technology, when the system, HBX systems improved, getting improved better and better, we see a reduction in the number of calls that the call center is taking. And that translates into number of licenses for predominantly the 400 plus licenses.
Are there any other questions on this matter? Yes, Venkat. Ted.
So, question for you, Venkat. So the cost of the license is about 1.1 million. What's the value of the software development using those licenses? Do you have any?
Yeah,
rough idea?
that's again a great question. We have a small team. We have 4 developers and 1 person kind of works between a bit of security and other functions. And we have shared resources from PMO who oversees the Salesforce development function. So totally you can say 5 or 6 resources. Somewhere around similar to $1 million cost would be on the resources side as well. And if we let's say in theory, we completely focus only on the CRM solution, nothing else is done, probably we'll have to spend half of what we are spending in terms of resources, but still the license cost is the same. So just to give you some.
And the licenses that they include end user license and developer license both?
Yeah, actually, Cynthia, please go back one more slide. Yeah.
Right there.
So the Service Cloud Enterprise Edition and Government Cloud, that 475 are how it's sold as the core licenses that can do many things, including the development work. And we have something called partner and community members, and you can see the larger number, customer community logins. Those are cost-effective way of utilizing outside of the organization where we don't have to actually issue the licenses, but we can give the number of logins as a count of measure, and that cost we found over time was significantly lesser than having a larger developmental licenses. The call center license is exactly the same license that our development team is using.
Thank you. Thank you. Other questions, please? To move ahead, they're being done, I think. Thank you. That's it. If there's no other business to be done, I'll take a message to adjourn the public session. But before I do that, we have a motion and we plan to go into closed session. First of all, I move to meet in closed session pursuant to general provision article section 3-305-1 to discuss performance, resignation, and other personnel matters that affect one or more specific MHBE employees. Do I have a second? Would you put the?
Second.
We lost. Hold on. All right. Do I have a second? Dana has a second. Any questions or comments? All in favor, say aye. Aye. Wait a minute.
Oh, Sharon, go.
All the vote specifically.
I did. Oh,
Each member.
have to have each member? Okay,
Dr. Allen had to leave, so he's not here.
okay. Secretary Schrader,
Yes.
Tony McCann, yes. Dr. Allen has left. Commissioner Brain,
Yes.
Ms. Rodriguez?
Yes.
Mary Jean,
Yes.
Ben,
Yes.
Singh,
Yes.
Dana?
Yes.
Thank you. The yeses have it. And with that, I move to adjourn. All in favor, say aye.
Aye.
We will reconvene in closed session in 5 minutes.
Cynthia, what's the instructions for people on the line?
I emailed everybody the number this morning. I mean, the link to register.
We'll stay here. Oh, okay.
Yeah,
Great.
do it through the-
Yeah. Okay.
Well, I'm gonna gosh,
Yeah.
I was waiting.
We're gonna stay in here.